My name is Andrea Harless. I am Senior Director of Government Affairs at G2G Consulting. I am based in Columbus. For those of you that aren't familiar with G2G, we are a government affairs consulting firm. We do local, state, and federal lobbying and advocacy. And some of my favorite work that I do in my job is the work that we do in nonprofits. So thank you all so much for being here today, but also for the work that you do. You do the most amazing work for your communities, and we are so thankful for that. So we're here today to talk about challenges and the power of advocacy. If you're based in Ohio, you know that we just passed our state operating budget. We also know the federal government is working through theirs, and there have been some big changes for nonprofits in terms of funding. So our goal today is to talk about those changes, share how you can advocate for your nonprofit, and then also to walk away feeling empowered. We know that sometimes these times can be really challenging, and what we want you to walk today is feeling so empowered to go out there and continue to fight for the great work that you are doing. And we have brought along the best of the best to get you there today, to get you the information you need, and to share some tips. So we're going to talk about opportunities, give some advocacy tips, and you'll hear from some different leaders in the space. So I am going to pass over to my amazing colleague, Becky Watts, who is going to start us off with a fireside chat. Becky, we cannot hear you.
Thank you. Sorry about that. Hello, everyone. And as Andrea said, my name is Becky Watts. I'm a vice president at G2G Consulting. I'm based in Cleveland, although I've lived in both Columbus and DC, working previously at the Ohio Statehouse and in the United States Senate in DC many years ago. I worked in government relations for over 25 years, and I am delighted to have the privilege today to moderate a fireside chat of leaders and advocacy experts in the nonprofit arena. Following our chat, we will hear directly from nonprofit leaders. So I will start by just mentioning our fireside chat with we were joined by the directors of Ohio's three human services chambers, Michael Corey, the executive director of the Human Service Chamber of Franklin County, Annette Iwamoto, director of Cuyahoga Human Services Chamber, and Mike Morosky, the executive director of the Human Services Chamber of Hamilton County. Again, following our chat, I will kick it over to Andrea and Veranda Rogers, the President and CEO of Pregnant with Possibilities Resource Center, to talk about her experience on why advocacy matters. So with that, I would love to ask Michael Corey to kick us off with an introduction of human service chambers generally, what they are, and then his human service chamber in particular. Michael?
Well, thank you, Becky. Thanks so much to all of you joining us from wherever you are across the state. And excuse me, thanks to G for having us and hosting this conversation. And Liz Powell, happy birthday. I believe it's your 40th. I would sing to you, but nobody wants that for their birthday. My esteemed privilege is running something called the Human Service Chamber of Franklin County. We're a chamber of commerce, essentially for health and human services agencies in Franklin County, though our members are serving people outside of Franklin County, across the state, and some across the United States. We were founded in 2010 with a pretty small purpose but important purpose of serving as one voice within for our then 70 member organizations. Our work has expanded since then to do local, state, and federal advocacy, to provide professional services and capacity building, to distribute free stuff, donated goods for nonprofit organizations, and pretty much anything our members tell us they want help with, we're eager to help them figure that out. A few years after we were founded in 2010, the good folks in Hamilton County developed an organization of their own, and you can see the wonderful ED Mike Morosky giving you a thumbs up there. And then just in December, the good folks in Cuyahoga County did the same. Interestingly, ours is the only state in the union with multiple local HSC-like organizations. In fact, there aren't many organizations like ours anywhere else. Austin, Texas has one, and there are some analogous ones in other communities. Every state has a statewide nonprofit association, but we think there's something really acutely valuable about the proximity that you can have and the relationships you can build and leverage and the collaborations you can further with the local nonprofit chamber. Just like in the business community, there are local, statewide, and a national chamber, we think it makes sense for there to be nonprofit equivalents of that. So if you're not a member of one of these three chambers, we'd urge you to become members. And if you're in a city or county where there isn't such an organization, we want to help remedy that. And I'm sure I can speak for Mike and Annette in that we know there are a few other cities in Ohio that are contemplating this as we speak. But we want to go national because we can attest to the power and benefit of being able to collaborate across the state with like organizations. So we want there to be more of that. And lastly, of course, G2G has been a great partner to us and to our members, and certainly to our peer organizations over the last several years. So thank you for my rambling presentation on what HSCs are.
No, that was great. Thank you so much. Really, really helpful. I will turn it over to Mike Morawski to talk a little bit about his individual organization.
Sure. Yeah, I won't say too much. We do a lot of what Michael does. We're fortunate down here. We have two other member-based organizations, One Source and Leadership Council, that do some of. Michael does all of it at his shop, which is why he has a massive staff of hundreds of people helping him every day. It's just, yeah, it's like hundreds. I will add something. But first, thank you again to G2G. My wife actually she works at an organization like G2G Government Strategies Group down here, and so without folks like y'all having really frustrating, oftentimes conversations, but important ones on behalf of agencies like ours, most of whom can't afford to have a lobbyist, it means a lot to us. And that I'll add to Michael's point is that has been the power of having local chambers, the direct influence. Um, the business community, if I may, when they come, they often come as one with an agenda or an item. And oftentimes when our sector comes, we come as many, which makes sense. It's passionate work, it's mission fueled work, and it's not always as aligned as it could be, or maybe sometimes should be. And so I feel, we've done a good job down here doing that. And then before I kick it to Annette, what's so powerful about what Michael said about the three chambers in this state alone, years ago when Michael and I were lonely and we didn't have a net to, like give us good ideas, we were talking like, what if there was a day when it would really matter to have the three most populous counties to have one voice? Well, here we are, and God love Annette for getting the job in December, and then everything just sort of up and changed. But the unity between our three chambers has been really powerful, and I do think it's important to note also, just like mental health wise, our members are going through a lot, and it's really tough. And most of our CEOs, EDs lived through COVID too, and so being able to be around like-minded, smart people trying to do good has had an impact. So, Annette.
Thanks, Mike. Uh, we at the Cuyahoga Human Services Chamber now have nearly 100 members, and as you've heard, we only started in December. Anyone who's met me over the last couple months would have heard me say that I thought I'd be spending this year kind of learning from Mike and Michael, getting this Human Services Chamber up and running here. But after January, it was very obvious that we couldn't just focus on building our entity. We really needed to begin the advocacy work. And there's a lot of power and safety in numbers and being able to talk to our senators, representatives, leaders at the county and at the philanthropic level about the impact that policies that are being made, the decisions that are happening, how they impact 100 organizations rather than just one person speaking loudly. I think it means a lot. So excited to be here and in conversation with all of you.
Thank you, all three of you. Really appreciate it. The introductions of your organizations and the collective voice that you offer for so many around the state. Would love to just start getting into the meat of the conversation. As I think Andrea mentioned at the top, we just passed in Ohio our state operating budget. The state legislature did. House Bill 96, which is the primary vehicle for funding programs and operations of state government. At the federal level, the One Big Beautiful Bill, Federal Reconciliation Bill, um, was also just passed. So, and that, as you mentioned, just started her job, but had her hands full with actual advocacy needs going on right away. So we'd love to just hear from you all, particularly on, we'll start with the federal level. Can you share, and I'll just open it up to all three of you. I know you all have deep backgrounds and opinions on this. Would love to hear your sense of an overview of what you found most concerning and notable in the latest federal spending bill, the big beautiful bill.
Can I go first? I'll use my seniority just the one time. So to preview our analysis of this piece of legislation, we call it the Big Bad Bill, since that's more accurate. We think it's the most intentionally cruel legislation passed in a generation. We'll start with that. $1 trillion in cuts to Medicaid, 185 billion in cuts to SNAP, and lots of other morsels that are really problematic for the health and human services sector. There is one clearly good piece that the housing folks are pleased with, and that was an expansion of the low-income housing tax credit that had been sought for some time, and that's a win. There are negative effects for charitable giving in the aggregate. There are targeted negative effects for immigrants and their access to healthcare and food. And some of those pieces hit immediately, whereas a lot of the other negative consequences in Medicaid and food access are going to come online later. Many of them after November of 2026, which is when midterm elections are. That is not an accident. So it's a really challenging piece of legislation, and it's one that passed on partisan lines with a modicum of bipartisan opposition with a couple of Republican senators that voted against it. There has been a lot of hemming and hawing about whether or not there are actually cuts. Well, they are de facto cuts. Everything else is sort of semantics on what the legislation will do in terms of people accessing healthcare and food. I want to note it's very difficult to project with specificity how many people will lose care in the state of Ohio or county by county at this point. I'm sure that Mike and Annette might have some, I shouldn't say I'm sure, they may have some specific projections they can share. We don't have specific projections for Franklin County at this point, but what we've seen is at least 500,000 Ohioans losing Medicaid access, and no one's confident enough to share a number on the SNAP piece for the state that I've seen at this juncture, aside from I think some of Annette's colleagues, the Center for Community Solutions, have put out some analysis there. But I want to note one thing that frustrates the heck out of me with this, then I'll shut up. In the legislation, there is a $50 billion fund for rural hospitals to help them withstand the consequences of the Medicaid cuts. So in the bill itself, it acknowledges that the Medicaid cuts are going to have a negative effect for some nonprofits, rural hospitals across the United States. There is no such fund to help mitigate the consequences of this for other hospitals or certainly traditional HHS nonprofits. And that's going to be a real challenge in the coming years.
Thank you, Michael. Appreciate that analysis. Mike or Annette, anything you want to add?
I would just underscore that what the bill does is really weakening our sector's ability to meet the needs in our communities while at the same time removing access to healthcare and food. And I mean that's a big challenge.
And the only thing I would add is I would double down. My initial reaction in my head to the question of like most surprising thing is to echo Michael. And most of Pollyanna has been beaten out of me. I'm not surprised by much, but the cruelty of it is just astonishing. Is how intentionally mean it is, and directed, to Michael's point, at certain groups of people, while providing protections for other groups of people that don't look like them, and that's concerning, to say the least. The only other thing I would add is don't have projections. Michael's right to think I may, but I don't. We have, we can make some good educated guess, nothing I'd be comfortable saying. But one of the things I can say for certain is our county does their budget process by October, it'll be finished. We don't know what the impact on them will be. And that's going to be another thing because of all the federal cuts, because the Health and Human Services cuts, the 10,000 people getting laid off, which was actually about 26,000 people with contractors, et cetera. Um, is having impacts on counties, and most of our levies, if not all of them, come to our members in one way, shape, or form. And so in October will be a whole new set of numbers to look at, and not to compound it because I know y'all are going to talk about the state stuff later, but that issue I just mentioned, combined with some of the state legislators' um, opinions and actions regarding property taxes and levies, is going to. I hate that we're starting like this, but this is the reality. It's going to make it even worse than Michael and Annette have said.
Thanks, Mike. So I think that's a good segue into the state budget and, in sort of between both state and federal, what um what does this mean for those providing services and health and human services and how they partner with government and access funding?
I'll start that one. Not because I'm pulling rank like Michael Corey did. I'm not like that. But the I'll stop picking. I'm sorry. You got to be able to laugh. I'm trying to lead by example. You have to be able to laugh at this. I mean, oh my goodness. So I won't speak for the other two. We talk a lot. Us three talked, a lot before. Michael and I talked a lot, but not like we do now. It is almost daily, and it's really great. And we share information, etc. So I know a bit about what they do, but our focus has really been to work with the Statehouse and stay hyper local with the city and the county folks. And we're really lucky down here. We have great relationships with our city and county officials, whether it's in administration or elected, and the school district as well. Doing our best to be intentional about reaching out to the outlying school districts so that Cincinnati Public doesn't just suck, all the air out of the room. Said respectfully as a former board member, I can say that. But it's what happened. We can't help it, right? And so paying attention, around us, the suburban ring of urbanish areas around us, a lot of those levees historically fail. And so trying to get more involved with how can we support y'all? Because we need your support. We know our fates are largely tethered to y'all. Yours are also tethered to us. And packaging up that kind of advocacy, because going forward, where we've kind of hung our hat as a membership organization is really working to prevent the worst case scenario now. And that is a win while looking 3 to 5, even 10 years down the line. Because right now, we're lucky again locally. We're lucky in some respects with friends we have at the State House, relationships with folks at G2G, government strategies, whoever it is, speaking on behalf of some member agencies. The federal government is a hard place to work with. It just is, and so that's kind of where we've hung our hat, is very hyper local. I'm proud to say that Cincinnati Regional Business Chamber just joined our chamber, and we joined theirs. And we're calling meetings together with Senator Moreno and with Senator Houston with their Cincinnati Compass Immigrant Initiative and our New Americans Committee. We went together. I can't say things are working, but I can say that that's sort of bringing in these other sectors into our chamber to stay informed, if nothing else, is having a powerful impact right now, as far as socializing issues that are really hard to socialize because they're so complicated. And we start talking about, people look at you like you're nuts. Like, that's not really happening. But it's helpful, building that bigger coalition.
Wow, I think that's really fabulous, Mike. And I didn't know that about Cincinnati. And I hope we can do similar things in other areas, in terms of working with both Human Services Chamber and business chambers, et cetera.
Yeah, and it's just I'm sorry, just a final comment. Again, I say this with great respect, having been an elected person in a former life, and policy chair through COVID of a big school district. So you can't scare me, I guess is my point. Uh, Elected officials, they need data, but they need cover. You call it support. Maybe cover sounds callous. I don't mean it to, though. And when a business chamber and a human services chamber come together with a similar goal, that's a lot of protection from, outside things. So that's kind of, I know we're doing a good job, I think, working with philanthropy too. So I think that's the best we can do right now.
I
Yeah,
think that's a good segue into like the power of the collective voice. And that's sort of one example. I wonder if Annette and Michael, you have examples where collective voices, messaging, leading advocacy efforts proved impactful in shaping a policy or funding decision, just to think about something perhaps positive, effective.
sure. I'll kick it off. Not going to go into this playing rank, but I think even with so many awful things that target our sector and how we can support the people in our community. There were some advocacy wins over this past month or two, and just to name a few, when the budget resolution was first introduced, there was a piece in there that would allow the Treasury Department executive branch to be able to, without due process, designate a nonprofit as a terrorist supporting organization and strip their nonprofit status. That did not make it into the final House passed bill, did not resurface in the Senate. And there was a lot of advocacy work done. The three of us, along with Philanthropy Ohio and Advocates for Ohio's Future, made a statement on it. And it didn't make it into the final bill. I think that's a huge win. I think if you look at the state level, the veto overrides, it was a win that only one veto override vote took place and was successful. I don't think that, I think a lot of us didn't expect that to happen. And that is the power of advocacy at work. There's a couple of other examples. I don't know, Mike, if you want to throw a few others out there. There's reason for hope, for sure.
Yeah, thanks, Annette. Excellent examples there. An alarmingly low bar that we prevented the federal government from being able to unilaterally determine us to be terrorist supporting organizations, but that's where we're at. They'll try it again, and I think we'll continue prevailing there. Um, I think it's frankly difficult to point to too many advocacy collective wins for our sector right now, but there are other examples. Um, some of the vetoes that Governor DeWine did make were examples of that on sort of culture war type deals. And as Annette noted, the veto override effort hasn't gone as smoothly as they'd like. They're not done. They have until the end of the year to try to galvanize their effort on that front. We'll see. We won't go down without a fight as a sector. There were some housing wins in the state budget. There were some food access wins, although not nearly as much as was sought. Funding is kind of moving back to pre-2020 levels, which doesn't make a lot of sense. But they were wins nevertheless from the cuts that were possible. I would say there was a really coordinated effort to get the Medicaid trigger language out of the state budget, and we did not succeed there. But where I think we succeeded was making the issue very widely known and understood as to the potential impact. And that helped at the federal level to block the most draconian cuts that were sought initially to Medicaid. So the Medicaid trigger piece won't be triggered immediately as the Medicaid cuts happen. So that could have been enormously worse. That would have rendered 700,000 Ohioans without Medicaid almost immediately. So win there with that collective effort, even if it wasn't a complete win on the state side. I do think that Mike is underscoring the key way forward because we failed a lot more than we prevailed in the collective advocacy as a sector at the state and federal levels. It's going to take a big, broad coalition to get wins on the fights that are right around the corner, on the federal side in particular, through upcoming reconciliation packages, appropriation spending, and so forth. And it will take the folks that we know have disproportionate influence on the handful of lawmakers that are going to be open to changing their votes and open to fighting in committees and behind closed doors for the priorities of our sector. And that's the business community. And like Mike, I'd say that our messaging alignment with Columbus's business community is as strong as it has ever been in my 8 years in this job. For example, there's a Columbus Chamber of Commerce for small businesses, but there's also a unique entity here called the Columbus Partnership. It represents the largest employers, mostly for-profit entities. For years, excuse me, they've been convening something called the War Room, which brings together cross-sector partners to seek what were then voluminous federal dollars during the Biden administration to bring them back to Central Ohio. That group has pivoted to now defend those investments while concurrently seeking new investments as the federal government retreats from decades of its priorities. And they've invited the Human Service Chamber to that group. I wish they would change the name, but I haven't succeeded on that advocacy front. But that is illustrative of the collaborative attempts that we can hopefully provide with and for the hundreds of nonprofits that we have the privilege of serving in our three communities.
Great examples. Thank you all so much. You've mentioned throughout your comments about the relationships with public policy officials, lawmakers. I wonder if you could talk, and in some cases, the lawmakers who have a significant influence over many of these decisions, who maybe don't necessarily represent your counties exactly, but other parts of the state. How do you approach building relationships with those lawmakers or state agencies or, both state, federal, in this current political climate? Who wants it? You're all smiling.
I think Annette should go first since she's new in the role, and it's probably been hardest and most imperative for you to do so, Annette.
Well, it's been surprisingly easy to get meetings, even if people are not necessarily saying what we agree with or would want them to say in public. We've been able to meet with them and their staff. I think a lot of, at least in Cleveland, there's been a lot of buzz about the Human Services Chamber forming and getting up and off the ground, and really a lot of decision makers see us as a resource to get information. And so, you know, it's been easy for us as a new organization to build relationships, to meet people and get out there. I'll say that probably a lot of that has to do with the ground that Michael and Mike have laid in their communities, and seeing the impact it could have locally. And it's not just those first initial meetings, but maintaining the relationships, sharing broad information about the impacts we're experiencing as a sector, to keep that relationship going, and trying to find points of alignment or agreement, or things where we might be able to move the needle a bit.
Great.
I'm gonna go second, make Michael go last. Again, it's like a full circle. I promised I wasn't gonna do any more picking, and I apologize for lying. So he knew it was a lie. Uh, so to answer the question, and then just add a little bit that I think is important to add for today, July 30th, 2025. But historically, I've done this kind of work for a while on the elected side, the lobbyist side. I was a lobbyist at Children's Hospital with Cradle Cincinnati for a number of years, um, and was able to work. I'm going to give props to Rep. Tom Brinkman. The man voted against ratifying the Fourth Amendment, and yet I was able to work with him to get the version of the DUA legislation that then my buddy Bill cites. I'm not ideologically aligned with either of these guys on a whole lot, across the finish line, and improve Black maternal health across the state. That the ability to do that now is a lot harder and almost impossible at times. And I have a lot of hope, I do, but I think it's important to talk about the reality of the relationship piece, because it's the thing. Whether it's our relationship as a sector with the healthcare sector writ large, the business sector, et cetera, we know the team idea right now is really important. The collaboration. Building relationships with legislators, there's always some kind of shared goal, typically, regardless of what it is. Tom Brinkman, he didn't like taxes. Well, guess what? You're spending a lot of money on things you don't need to be spending money on, because you're not taking care of Black maternal health. You're not taking care of poor rural folks, and their babies are taking a lot of money. Groundwork Ohio, Shannon Jones did some of the most amazing work I've ever seen, and got to the point where, sadly, it's so polarized that you're on this team or that team, it doesn't matter. And talking the economic argument of, well, we're going to save money if, doesn't go quite as far. We're lucky, if I may. I think we have, a governor and some senior leadership up in Columbus that really wants to have those conversations still. But it's hard for them too. And so again, I think it's the shared interest piece. How can we work together and, not going into meetings expecting everyone to have the same opinions as you, like I did 25 years ago. I'm not wise. I'm tired. Maybe it's the same thing, but you can't have that expectation. Um, but I do think it's only fair to warn folks that now having a collaborative, this is not a sales pitch for our chambers. It's going to sound like it though, but it's not. Maybe it is. It is. Having the collaborative power of the team right now is really important because it is difficult now, but it's still possible.
Yeah,
Thanks, Mike. And Michael, I think we'll wrap with your comments. Thank
I'll
you.
go real fast. As Mike would say, I guess, the less I speak, the better. Um, so Liz made a thoughtful amendment to my commentary that we can't go silent, and that's absolutely right. We have to keep making noise, keep making connections, keep pushing, because this is chess and checkers, and we have to play both. And we have to play the immediate game, trying to defend members and their priorities, but we have to be bracing for and building toward what comes next, whatever comes next, whenever that does arrive. So the things you lose in legislation now, you're building toward wins down the road in every relationship that you're building. And we have two brand new U.S. senators in the state of Ohio that aren't going anywhere, at least for a couple of years. Houston has to go for re-election next fall. And their staffs have been very receptive to meeting, even if we haven't seen tangible consequences and how they voted at this juncture. And that's been true not only for us, but for our members. We're hearing mostly really good report outs for how those conversations go and site visits go. And that's part of it. You have to build relationships with the staff. That's the key. And then with the electeds themselves, you find the people that can reach them directly and get them engaged. And a lot of times it's on member boards. A lot of times it's in the business community and the opportunities that are there. And it's not just going to them and saying, we need you to do X, Y, and Z, or we need you to tell your boss to do X, Y, and Z. It's concurrently saying, here's how we can be a resource for you. That was the thing that we would do with Senator Portman's office, and his office was tremendously responsive, a great partner, even if our priorities didn't align even beyond 50% of the public policy issues. They were great to work with. And we're hoping to have that kind of productive relationship with our two new U.S. senators. And but to wit, you have to focus where you can have the most influence. That tends to be at the local level, just because you see those folks much more often. They're much more proximate to the issues. And as I think has been intimated, the best thing anybody can do along those lines, and I'm sure G2G will elaborate on this, is you got to get them out and see what you do and see the people you work with and see the people that are affected by the big changes that are coming and that happen behind a desk at the policy level.
Yes. Thank you so much, all three of you. Really powerful comments. Great to hear some updates on what you're working on. We're going to let you go for a few minutes off screen, come back for Q&A at the end. I know some questions have popped up in the chat, but now we're going to turn things over. I will turn it over to Andrea and my team to introduce our next speaker, Veranda Rogers. And Andrea, it's all you.
Thank you, Becky. And Michael Corey set this up great to hear from Veranda Rogers. We want to hear from a nonprofit CEO herself, and Veranda, I can think of no better example truly than Veranda. She has been doing advocacy for a while, really engaged in it last year, and she knows the importance of this for what she does. She is the founder, the CEO, the everything woman behind Pregnant with Possibilities Resource Center, which is located in Cuyahoga County. And we want everyone to hear from her. And so, Veranda, if you can just share why did you engage in advocacy? Why is it so important that nonprofit leaders advocate? Right now, there's a lot of people on this right now. You're talking to nonprofit leaders. Why did you engage in advocacy? And what would your message be to maybe a nonprofit leader that's wondering if they need to speak up right now?
Absolutely. So good afternoon, everyone. Thank you, Andrea, for that wonderful introduction. I am Veranda Rogers. I always like to introduce myself by saying I was born on purpose for a purpose that I serve as I do child and infant maternal health work. What that means when I look at advocacy, advocacy is not optional. It's absolutely essential. And while as a leader, a founder of an organization, I wasn't truly aware of all of these things when I first started in 2015. I would probably say in the last 2 years, my advocacy efforts have absolutely ramped up, and I recognize that it plays a critical role in your nonprofit visibility, in your collaboration, and the opportunities that are available to you. So to me, it became clear that it was the turning point of what made us good in order to be great. So often, what we see is we see all of these organizations receiving funding. And if you're a small grassroots organization, you may have impactful work. You may not have the infrastructure, you may not have the team to do advocacy, but advocacy matters because that is how legislators are aware of who you are. It's also a way for you to show up. It's also a way for you to share stories of the clients that you're serving and supporting, to share your data. We actually have impact reports. It also allows you to represent the voices of the community that you serve or your particular target audience. While legislators may sometimes be in their bubble or they may be in their geographic area, they don't know what's happening if you don't actually show up and tell them. Through our effort, we've had an opportunity to invite legislators, and I would probably say we've had maybe at this point 40 legislators just come and visit our space. Because if they can see it in real time, what we're doing, having clients here in our space when they walk through, so that they get an understanding and they can put a real face to a story, or the client can actually share their own story if they're in our space. It has made a world of difference. I also show up in Columbus. I've had the privilege of showing up in DC. And through this work, it actually, what I will say this year, it translated into us being tapped by Congresswoman Alma Adams. She is looking to reintroduce a community health worker bill. We actually support community health workers here at our facility. And because of that, she asked me to review this bill that she was going to reintroduce and share my expertise of what I was seeing, what I was experiencing. So those are other ways that as you start to do advocacy, and while let me say this, it could be very daunting showing up to provide testimony. This past year, I showed up for House testimony. I showed up for Senate testimony. So being there, being present, as well as scheduling meetings. And while you may have 10 minutes or you may have 30, you have to be very succinct in what it is, the message that you want to hear. That you want to tell. Understanding that you sometimes have to be able to switch and tailor that message to who you are speaking to. Because what may be absolutely important to you, you have to know the priorities of the legislators, and you want to be relatable. So be able to build some rapport with them. I remember, I think it was maybe like 2 months ago, I went to sit down with the legislator, and immediately it was like she did not want to hear what I had to say. She was turned off. We were able to build rapport. Her son was a student at University of Cincinnati. I have a student who's at University of Cincinnati. I was able to build rapport with her. And so, like, while at first she was turned off, she was like, well, doesn't this organization do this, this, and this? And I was like, yeah, but let me tell you how we're different. So I was able to absolutely sway her mind, and we were introducing a bill in the House that we wanted to get, not a bill, but we were trying to be a part of the state budget. And so I'm like, can I get you to champion this cause? And based off of me being able to build rapport, I was able to switch her mind literally. And I think we just had a quick 15-minute conversation. So understanding that the story and the narrative that you tell, you have to be able to tailor it to who you're talking to make sure that they understand how it can also benefit their constituents. We're here in Ohio. How can your program expand across Ohio lines? How can it be replicable? Because while it may be beneficial or impactful in the current area that you're located, sometimes they're also looking to know how that impacts all Ohioans as from a collective standpoint. So I would say for me, our work is far from finished. Advocacy amplifies your impact. it allows people to understand your mission. It allows for your families to be seen, for them to be heard. And so while it can be daunting, get good people, get a legislative team, get other people who are in this fight with you. And so you can walk alongside this journey because it's a long journey. It is not a sprint, it's absolutely a marathon. And know that just because you may get a no, it may not work out today, over time, you will start to see the benefits and the fruits of your labor.
Veranda, we could end the whole thing here because that was so great. That was amazing. And Veranda's right with everything. I was in Veranda's talking about where we came in, the legislator was a little fired up, and by the end they were friends. And it's so important that you're in there and you're talking to legislators. What Veranda's talking about with the bill at the federal level, legislators came to her before the introduction of the bill. So you're not having to play defense, you're there from the beginning, and that is a huge win. And I know that for a lot of nonprofits, we look at funding as being very important, and a lot of nonprofits try for funding in state budgets and federal budgets, and maybe we're not successful, but being there and being a resource and an expert, I think Mike said it in the chat box as well. You are there to educate. I always tell people when they're nervous about doing a meeting with the legislator is when you're sitting in a meeting with a legislator, you are the expert in the room. You know exactly what you're telling them about. You're there to educate them. So thank you, Veranda, so much for your words. And I think we're going to put the slides back up and talk a little bit more about keys to advocacy. And we will try and go through this. I will say we're going to talk a little bit about the capital budget, and I could probably spend a whole hour webinar just talking about the capital budget. So I'm going to say as high level as I can on this one. We'll talk a little bit about timelines and budget cycles. I just had a meeting yesterday with who is the director of the Ohio Office of Budget and Management, and she was saying people think now that the operating budget is over, we're done. She's like, that's just one piece of the puzzle. So we still have a long way to go. The budgets are cyclical. Operating budget this year. We will be doing capital budget next year in Ohio. We're going to talk a little bit about federal earmarks and then some tips for advocacy and relationship building. So on our next slide, let's talk about the capital budget. Again, I could spend a lot of time on this, so I'm going to stay really high level. You will get copies of the slides. Who is eligible for nonprofits? Very first piece of this, nonprofits. Sorry, who is eligible for earmarks is nonprofits. Sorry about that. So we're in a good place here with all of you who would be eligible. Really, colleges, universities, state and local government also eligible. So not a for-profit business, but nonprofits are. So what qualifies? The capital budget is capital. So we are talking about a bricks and mortar projects. So we are talking building a building, expansion, renovation, repair. There are definitely a lot of rules about what the funding can be spent for, but we are talking about bricks and mortar projects. So if you have a capital campaign that you're working on, this could be an opportunity for you to get funding. There are rules, like I said, you should already have funding raised toward the project that you are asking funding for. So we have people sometimes say, in 5 years, we want to build a building. That is not the time to ask the legislature for it. The legislature likes to be those last dollars in, not the first dollars in. So we recommend definitely having more than half of your budget already either raised or committed for the project before you come to the legislature. Again, they want to be the last dollars in. So having some funding raised toward the project is really important. How much funding can you request? This answer really depends. It depends on the total project cost. It depends on the size or the budget of your organization. Again, we would recommend you're not asking the legislature for the full amount. Less than half is about 30% is what we recommend, depending on it. If it's like a $250,000 project, sure, maybe you can ask for 100, 125. If you're looking at a $5 million project, you don't want to ask for half of 5 million. And I see some people asking about sharing slides. Yes, we will definitely be sharing these slides. Some interesting pieces. And again, this is why I say that I could spend a whole hour just on this slide. There are a lot of requirements to make sure that a capital budget request is qualified to be in the budget. So the project has to extend for the life of the bond from the financing agency of the project. What does that mean? Whatever the state is paying for needs to generally last about 10 to 20 years. So that's why a roof on a building, that'll last 10 to 20 years. That's bondable. Computers, not so much. An HVAC system, that typically is going to last you 10 to 20 years. We hope so at least. Windows are something we've oddly come up against, that windows are not considered to be bondable. So there are a lot different things that will and will not qualify. That depends a lot based on the agency through which you're getting funding, which goes into the next piece here about the nexus to the state. This is something that tends to be a little more complicated. So there are certain state agencies that are a nexus from the budget to you, that the funding flows through. There's about 7 that qualify for funding through the capital budget. Typically with nonprofits, it is the Department of Higher Education, which means you have to have a relationship with a university to have the funding flow through them. Again, I know this is a lot of information, but another piece of that is that there has to be some sort of advantage to the university that it's flowing through. So I'm going to give an example because I think this is the easiest way to explain this. A few capital budgets ago, we were working with a nursing home that was located in Cuyahoga County, and they were putting lifts into their rooms for their patients. So these are lifts that could take them from the bed to the bathroom or wherever they needed to go. We know there's a huge advantage to that for the workers, that is saving their back, that is giving them many more years that they are able to be of service in their positions. So they asked for capital budget funding. They had relationship with a local university, and we were able to flow that funding through the university to the nonprofit because the nonprofit had students from the university doing clinical hours, internships, stuff like that at the nonprofit. So there was an advantage to the university and there was an advantage for the nonprofit. So that was kind of how that flow of funding works. I will tell you that that is something that when we look at a capital budget project that someone may be interested in, we look at that really closely, making sure that it is eligible for funding. And that is something that can take a little bit of time, which is why I think I'm gonna jump over to the next slide because I want to talk a bit about the timelines. I know we are get about 10 minutes. We have about 10 minutes left. Um, all that to say, this is why we should start working on capital budget thoughts now. Assessing your funding needs, developing your strategy for funding, and making sure it's going to be eligible. You do not want to go through this whole process and have a legislator say, this is great, but this is not what capital funding is, or this is great, but we can't fund this. So you want to make sure you have that narrative in place now. Like I said, when I was talking to the director, she's like, we're already having these conversations. I was at an event with Chair Serino the other day. They're already having those conversations. You should already be thinking about what could be capital budget eligible, developing your strategy, developing your messaging, making sure that it works. Typically, toward the end of the year is when you will be meeting with targets. The legislature will be back about October in Columbus. So that is your opportunity to educate legislators on your project, what the value is to the community that you serve, what the value is to the organization, educating them on your organization if they're not already familiar, inviting them out for tours. I know Veranda talked about that. Once you get a legislator in the door, they can see your organization so much more clearly than you just explaining that to them in a meeting. The capital budget has forms that you fill out. You need to be able to fill out these forms. These deadlines can really change, so I don't want to harp too much on that. But you have to make sure you get your form time. You're creating a good narrative. You have a good ask. And the key thing about the capital budget is it's what we call a pre-negotiated bill. So unlike the operating budget where it goes to the House and it goes through hearings and there's testimony and then they do an omnibus amendment and then they do all this, whatever is put out in the House typically is what comes out in the Senate. So you need to make sure that very, very early on in the process, you have your regional delegation on board so they can put you in that first version and get you all the way through. And that typically happens within about 3 to 4 months in the legislature. Again, these can be subject to change, but by the end of April, early May, the capital budget is done. So this is a really, really quick process, which means you want to make sure you start doing those pieces now. We can definitely answer any questions that you have about the capital budget. I do make sure I leave some time for Becky, who's going to talk about federal earmarks. So I will pass over to her.
Thank you, Andrea. And just a follow-up, I know Andrea was talking about, she was with Director Marinox yesterday. I will be with her tomorrow in Summit County, where she's coming to visit a project for which we've gotten capital budget funding in the last 2 cycles. So she's coming out to actually see the results. So I just say that to say you have to continue following up with your elected officials both before, during, and after these decisions are being made. And this is sort of a thank you, continue cultivating the relationship with her. So I'm excited to host her to show her the results of that state funding that has been secured over the last few years. So federal earmarks are another way to access funding for your nonprofit that's sort of out of the realm of traditional competitive grant processes within the government. For the past 5 years, members of Congress have been engaging in this process to fund specific projects in their districts through the 12 federal spending bills or appropriations bills that Congress has to pass every year to fund the federal government. So at the federal level, it's annually. State, it's biannual. These projects for nonprofits and local government entities and universities used to be referred to as earmarks. That process was banned for about 10 years and until Congress brought it back. Now they're called congressionally directed spending in the Senate and community project funding in the U.S. House of Representatives. It differs from funding allocated through competitive grant programs, through federal agencies, because it's the member of Congress who makes the decision. So this is where you having members of Congress and their staff out to tour your entities is for building those relationships, going out to DC to meet with their staffs, and sometimes the members themselves also very critical. Again, who is eligible, nonprofits, colleges, universities, state, local government entities. These are typically 1-year funding requests. Matching dollars can be very helpful. They're not always required. It depends on which federal agency you're seeking that federal funding through. And then these earmarks are for programming, some cases, equipment or in construction, and more of that capital funding. It varies depending on the year. Congress changes their mind about, and leadership changes their mind about which way they're going to approach programmatic requests versus capital type requests. How much funding you can request. Again, this is very variable depending on the account, your project, how much money you already have raised toward it. We've seen earmarks in the range of 50,000 to 5 million at the federal level. What makes a successful earmark? Community support is absolutely crucial. I think it was Mike earlier was talking about that cover. It gives a member of Congress cover to know essentially, yeah, there's a lot of people locally who want this project to happen. So securing letters of support from local elected officials, from partners is a really key piece of it. Having an op-ed in your paper or some kind of article in your paper describing the need, it can also, your local media markets can also be really helpful. Alignment with members is crucial. If you know a member of Congress is all about girls in STEM comes to mind, and you're doing some work on girls in STEM education, that could be a really great type of project to propose. Timing on this, while February through March is when individual members of Congress put out their deadlines, now is when you should be really starting to work on it, figure out your project proposal, meeting with the local staff for your member of Congress. We're currently in July, we're kind of going through the markup process at the federal level, which is when the bills advance. The individual appropriations bills advance in both the House and the Senate. And then typically we'll see either an omnibus bill at the end of the year where all the bills are kind of smushed together, or even continuing resolutions, which is what happened last year, but we're hopeful that doesn't happen this year. Just a few examples. I won't go over all these. I mentioned the girls in STEM. That was top of mind. Obviously, that was when we worked on it for 850,000. And then I think, oh yeah, at the bottom you can see the Jennings Center for Older Adults. That was related to actually the lifts that Andrea mentioned earlier. So all different types: city sewer, violence prevention, STEM, youth engagement, lots of different types of earmarks. And I'm speaking quickly because I know we're at the end here. We've talked a lot about these tips on advocacy and how to approach it. I mean, really, you want to developing a consistent message that explains your mission, your impact, and your policy needs is crucial. Using data and stories, we've heard that mentioned, to show the scale and human impact, absolutely like a key piece of that messaging. Train your staff and your board on how to speak effectively about your organization because they're out in the community. They are interacting with elected officials as well. Leveraging media with newspapers, newsletters, op-eds, social media posts, staying visible to these policymakers and the public, and responding quickly and professionally when opportunities arise to comment or engage. As Miranda shared with us earlier, she was given this opportunity to comment on legislation before it was even introduced. That's as a result of her being active and being in front of the congressional office before it even happened. Next slide. Relationship building, we've talked a lot about that, bringing people out, very key. I think I've covered everything else. So I will say, if we could just bring everybody back, if there are Q&A for the last 1 minute or so here, and we've got, I know in the chat, we put ways to join the Human Services Chamber if you're interested, the different human service chambers, and I think most of you know how to reach out to us at G2G if you have any follow-up questions. So, Andrea, any other questions you think we need to answer in there?
There's one really good question in the chat that I do want to address, and it says, it seems that eligible use opportunities for nonprofits to receive federal earmarks have been shrinking over the past few cycles. How can we still find a pathway of eligible funding for identified projects? This is a great question, and it's very true. Anyone that maybe was engaged in the federal earmark process, a couple years back, there was some opportunity for nonprofits to get funding through the THUD bill, the Housing and Urban Development Bill, and that has been taken away as an opportunity for nonprofits. We also know the House is no longer doing labor, health, and human services earmark requests, which is a lot of probably what your organizations do. The answer here is really getting creative and maybe how it will fit into other accounts. And this is something that we at G2G have been able to do with some of our clients is look at the program that they're working on and how it may fit into other parts of the bill. So there is the Commerce Justice Science Bill, which, some parts of that look at criminal justice. So if you are working on an initiative that maybe at face value seems like it could be more of a health initiative, but it can also go toward, lowering crime rates or helping kids, youth prevention type opportunities. There are ways to get creative with what you are doing because you are not just doing the one thing that you probably say you're doing every day. You're doing a lot of other things. So it's a little bit of creativity, and a lot of it is the narrative, making sure the narrative fits within what you are asking for. You obviously have to hit the qualifications of the bill. And it has to fit there. I think you would be surprised other ways in which you may fit in other bills that may not seem like it at first. So all that to say, yes, I do think there are other opportunities. It just is going to require a little more creativity now.
Well, I think we are at the time here, so I will just ask one sort of final question of our panelists. Again, thank you all so much for being part of this today and having this really valuable discussion. I think if you could share perhaps just one takeaway that you would like to share with our audience and our, the people who have dialed in, sort of an action takeaway that they should be thinking about as they walk away from the session. I will start with Mike Morass.
Thank you, Becky, and thanks again for hosting and to everyone for showing up. The takeaway and observation I've made that I would like to share, and I think it's very positive. I'm not melodramatic enough to say that the paradigm is shifting, but I do believe it's changing between nonprofits and funders and philanthropy and local government. Often, at least in my career, 20 years of this type of thing, in one way, shape, or form, from leading agencies to doing lobbying to education, whatever, is that typically it's us going to people asking for things. That's just kind of the paradigm you sign up for in our sector. And more, and it was confusing and difficult at the beginning to figure out how to use this as a true, powerful advocacy opportunity. But more and more, philanthropy leaders are calling us and asking what's needed. The healthcare industry is asking us, and not so they can fill out a box that they have to do for the Department of Medicaid, but actually want to know because all the ERs are overloaded and it's going to get way, way, way worse, et cetera. Business community to us because we are collecting the real numbers. And so there's an opportunity there that's powerful to create a system of partnership so that it doesn't just happen every time there's a crisis. Let no good crisis go unused, I guess. And so um, it's been pretty powerful down here. Michael and Annette hear me. I tell them stories over and over. It's, Cincinnati is a real close-knit, town, and it can be good and bad. And right now it's real good. Everybody went to school with so-and-so whose dad was the fireman down their street and eats at Price Hill Chili twice a week. Everybody. We all like the Reds, the other teams. But no, I'm just kidding. We like them all. So that's a powerful thing. And maybe, if you don't have the same conversations we have every day, you may not see it, but start looking for it. And I think you'll start to see that there is some serious power in our sector, as strange as that might sound after a lot of what we talked about, to prevent madness now. And I'm just going to end where I began while planning for 3 to 5 years down the road.
If I can just jump off of what Mike has shared, what I've seen time and time again, and I've been so grateful to be able to be in some of the meetings that the chambers and in Franklin County and Hamilton County, some of their meetings, and what I've seen with our members up here is that sometimes we come into rooms together really in kind of a pessimistic, downtrodden state, especially when things like the budget bills have passed. But there is such a resolve that the people that we serve are just too important. The needs are too great that we have to come together and work together and find a way to make magic happen. And nonprofits are the best at being able to do that. We're going to be better the more we work together at it. And so I just think the more we can get together and look at these community challenges, how we assist people in maintaining coverage and navigating new requirements for Medicaid or for SNAP, we're going to make it happen because what we do is just too important not to.
Thank you. Michael, will you close us out?
Sure. Again, thanks to everyone for all the work that you do. Excuse me, for all the work that you do. Makes me choked up. I think that the final thing I would say is in any conversation you're having with a public official, we have to be succinct and we have to be clear. They have to know precisely what we're asking for, and we have to give them something memorable that they can then take up the flagpole, because every one of them has a flagpole. They have to raise it up to do anything. It's going to be a very, very long haul here. We have to be bracing for the emergent challenges and building toward what comes whenever the next arrives. But at every step of the way, we have to be succinct and clear about what's going on and position ourselves as partners through this with whomever we're working with. And at the local level, there are more opportunities for that than at the state level and at the federal level, but all of the levels are going to be critical for our sector's ability to stabilize the community through the changes that are coming. So thank you for the chance to do this and have this conversation, and I'm sure we'll be talking again soon.
Thank you all so much for being here today. Appreciate Michael Corey, Mike Moraski, Annette Iwamoto, Veranda Rogers with her awesome quote, "Advocacy amplifies your impact." And we will close on that and look forward to our next get together. Thank you, everybody.
Thank you.